Hello everyone, my name is Dr. Deom and we're here with another wonderful episode of Eyecare Today. We're coming to you live from Hazleton Eye Specialists here at 281 Airport Road, Hazel Township, Pennsylvania. Telephone number 570-453-2020. Give us a call for an appointment today. For everybody in Stroudsburg, we're at 852 North 9th Street in Stroudsburg. Telephone there is 570-421-3342. So give us a call there. Also on the web at drkisland.com. We have a brand new website, so check it out. One of the areas on the website that is new is a subclinic within our practice. As you know, we have the Dry Eye Center of Northeastern Pennsylvania. Dr. Kisland, a nationally recognized expert in dry eye, leads that center. We also have the Scleral Lens Institute, which is a subclinic of both Hazleton and Stroudsburg Eye Specialists. And so what we're going to do today is talk to you about some corneal conditions and actually take you on a journey of what it's like to have keratoconus, which is a pretty rare condition that you may or may not have heard of before. And we actually have a real live keratocone with us today, a good friend of mine and patient of ours, Kayla. Kayla's going to share with us her experience with keratoconus and having scleral lens prescribed for her here at the Scleral Lens Institute. And we're going to go step by step through the process of what it's like to get fit with a scleral lens. So thank you for being here today.
No
Kayla,
problem.
Appreciate it. So what is keratoconus? And how does one come to know that they even have keratoconus? Well, keratoconus is a condition that causes a progressive, sometimes progressive, not in all cases, corneal bulging or thinning. And so first, let's start off with talking about what is the cornea. Did you know what the cornea was before we talked about keratoconus?
No, to be honest.
No, yeah, I think a lot of people don't know what the cornea is. I think we just think, well, I need glasses or contacts, let's go to the eye doctor and they'll fix me up, right?
Yep.
But oftentimes there's a little bit more to it than that. And so let's talk real quick about what the cornea is. So the cornea is the front part, the clear covering of the eye. So you have this clear covering over the front of the eye. And that is what bends light and focuses it on the back of the eye or the retina. And so a normal eye, quote unquote, should be perfectly round and symmetric. And in individuals who have keratoconus, it is not round like this. It is actually shaped like a cone, like this, okay? And what that does is it makes it impossible to correct your vision with glasses and contacts.
Correct.
So what I want to do is ask you, have you had glasses before or contacts?
I'm sorry. I had glasses before, but it didn't work at all.
What did you see when you got your glasses?
To be honest, I didn't see a lot. It was all blurry.
Okay. And when was your first eye exam? When did you first have an eye exam?
Back in April of 2013.
Okay, so a few years ago you had an eye exam, and what did the doctor tell you at that point?
They referred me to another eye exam, which was Eye Consultants of Pottsville.
Okay.
And they told me that I had
Keratoconus.
Yeah.
Okay. So you went somewhere and they said you need to go somewhere else, which often occurs. Yeah. They said you had keratoconus, and then what did they do?
They tried fitting me to contact lenses.
Okay.
They started with soft contact lenses at first.
Okay.
With a hard contact lens.
Okay, and they call that piggybacking.
Yes.
They put a soft lens on the eye and then a hard lens over it. That's called piggybacking.
And they told me I had to wear glasses.
On top of the two contacts?
On top of the two glasses.
So a soft lens, a hard lens, and glasses?
And glasses.
Okay.
Yeah.
And how was your vision with that?
Still blurry.
Still just as bad, okay.
And I kept, the lenses kept falling off.
Okay.
So it was no use. So that's when they referred me here.
Great.
And that's when my life changed.
Well, thank you so much. That's a wonderful thing to hear, and we're excited to talk more about it today. And oftentimes and I appreciate you sharing your journey, because oftentimes that's what a lot of people, the journey they go on, and many times, unfortunately, lots of places don't know of someone who is able to take care of this. So, for everyone watching out there, if you've had a similar experience, you're unable to see better with glasses or contacts, you may have keratoconus, and you should come in and get your eyes evaluated. And you'll see today say that we have the technology and expertise to be able to handle you unlike any other. Individuals who may have keratoconus oftentimes are in their 20s and 30s, but it will stay with you for life. So this is something that maybe you've been dealing with for a long time and never knew you had, but oftentimes first shows up in the 20s and 30s. It can progress, and in some rare cases it can end in a corneal transplant. However, this scleral lens, this contact lens we're going to talk about today, is really revolutionary in offering people vision like they've never had before. So again, we're here at Hazleton Eye Specialists in Hazleton Township at 281 Airport Road, Hazel Township. Telephone number is 570-453-2020. Everybody in Stroudsburg, we're at 852 North 9th Street. Telephone number there is 570-421-3342. We're on the web at drkislin.com. If you have keratoconus or a loved one has keratoconus, give us a call today. Set up an appointment for an evaluation for scleral contact lenses. They can change your life. Thank you. Hello everybody, Dr. Deom again from Hazleton Eye Specialists, coming to you today on Eyecare Today, and we're talking about keratoconus and scleral lenses. Very exciting stuff. So we're here today at our Hazleton office, that is 281 Airport Road, Hazel Township, Pennsylvania. Telephone number 570-453-2020. Give us a call, schedule your appointment and evaluation for keratoconus today. If you're in Stroudsburg area, Pocono area, we're at 852 North 9th Street. Telephone number there is 570-421-3342. Also, check us out on our newly designed website, drkislin.com. Fantastic website, tons of information there. So we're here today with Kayla, our very special guest, who we are going to basically show you the journey we go on for people who have keratoconus. And so Kayla was referred to us, as many of you know, by a office in our area who felt that it would be best for her and her well-being if she came to us to be treated for keratoconus, something that we deal with quite often. So the path for which people go on with keratoconus here at our office is quite extensive. We have a lot of technology that really allows us to give the best care to our patients. So the first thing we want to do is evaluate the patient's tear film. The first thing we do is check the quality of their tears. And we do that by using this device right here. This is an osmolarity tear tester. So what we'll do is we'll actually have the patient look straight up to the ceiling. We take this osmolarity tear test and we place it right at the edge of their eye. And we'll have them blink, and then it beeps. When it beeps, it has gotten a sufficient sample of their tears. And so we do that on both eyes. We do that on both eyes just like so. It blinks, it beeps, and then we take it, we plug it into its terminal, and it gives us a number. Individuals with keratoconus have a very high incidence of dry eye syndrome, and that can often lead to rubbing of the eyes and irritation, which can further worsen the cone or keratoconus, causing further damage to the cornea and maybe even causing a need for a corneal transplant. So we want to really make sure we get ahead of dry eye or any eye irritation that may cause eye rubbing. So this osmolarity test gives us a number to determine the quality of the tears. The second test we do is something called inflammadry. Inflammadry is a test that takes another sample of tears, and basically what this does is a tiny little test tube. We take it, we have the patient look up again, look straight up, we gently touch it to the eye, it gets another tear sample, we take that, we let it sit for a few minutes. Kind of looks like a pregnancy test. So my joke to patients is, the good news is your eyes aren't pregnant. And then I say that's my only joke. That's all I got, which is pretty much true. And so basically what that tells us is whether or not there's a specific molecule that causes inflammation in the tears. And we know inflammation is the root cause of dry eye. So if we see this inflammatory molecule, we know we should be treating dry eye. Again, for individuals with keratoconus, this is very important because eye rubbing can cause further damage damage to the cornea. Many times I'll talk to patients and they'll say, what caused this? What happened? And we say, we really don't know what causes keratoconus. It's not genetic. There's really no known cause, but many times we think that individuals have had bad allergies and have rubbed their eyes a lot through their life. So the next thing we do is we take a measurement with a device called a topographer. A topographer measures the peaks and valleys of the cone or the eye, and that's very important in being able to fit somebody with a contact lens. So what we do is that we have the patient come over, we come on over, we have them put their chin here on the chin rest, forehead up against the top bar, we line up their eye with the device, we move in, we get a really nice image, we have them blink a couple times, we click the button, go ahead and relax, tilt your head back, and then we get an image here on the screen which shows us the peaks and valleys of their eye. Okay, so what we see here with Kayla's eye is a cornea that is very steep. The red colors here indicate steepness, and the cooler colors indicate more of a flat picture, okay? So the cone, the area where the eye is steep, is down here in the inferior part. And you can see there's quite a lot of steepening in that area, and this is in definition the keratoconus, the cone of the eye. The next thing we're going to do, and this allows us to fit the patient with a contact lens that exactly matches the contour of their eye. The next thing we do, and we actually did this before, so we don't have to have the patient come over, we'll have the patient put their head here on this machine. This is a microscope called an endothelial spectral micrometer, and what that does is it measures the very inside of the cornea, and what you can see here is that we have right here in this area the shape of the cells on the inside of the eye. We're born with about 3,000 cells, and you could see here the patient in the right eye has 2,800 cells. We're born with 3,000, so that's very good. They degenerate a little bit over time, and we want to make sure that as we're treating this patient that they don't lose corneal cells with scleral lenses. The other eye you can see has less cells, around 1,400. So it's good to get a baseline number to make sure that as we're treating the patient with this lens, we're not losing cells over time, okay? The next thing we do is we take a picture of the back of the eye, the retina, because we're focusing a lot on the cornea, the front of their eye, but we don't want to forget the back of the eye. So we always dilate and try and make sure we get a good look at the back of the eye, but it's nice too to have a picture of the back of the eye where we're seeing the patient's optic nerve, blood vessels, and also their macula to make sure everything's good and healthy in the back of their eye, to make sure they're not at risk for retinal detachments. People who have higher prescriptions, more nearsighted individuals, do have a higher risk of having a retinal detachment, and people who have keratoconus tend to have a higher prescription, more nearsightedness, and sometimes a higher risk of retinal detachment. Next, we're going to go and show the process of picking the lens, putting the lens on the eye, and seeing what the patient feels like. Again, we're here at Hazleton Eye Specialists, Hazel Township, Pennsylvania, 281 Airport Road, telephone number 570-453-2020. Give us a call. We're also in Stroudsburg at 842 North 9th Street, 570-421-3342. Stop by in either Hazleton or Stroudsburg office for your keratoconus evaluation and scleral lens application today. Hello everybody, this is Dr. Deom coming to you today from Hazleton Eye Specialists. We're here with our final segment of our Keratoconus show on Eyecare Today. I know you all are super excited about that. So here we are at 281 Airport Road, Hazel Township, Pennsylvania. Telephone number 570-453-2020. That's again our Hazleton office. We're also in Stroudsburg for all of you out there in the Pocono area at 852 North 9th Street, East Stroudsburg. And our telephone number there is 570-421-3342. Give us a call. We're also on the web at drkislin.com, so check us out there. So today we've gone through the process of showing you, what it is to have keratoconus, what some of the initial tests are that we do, some of the technology that we have here that really can't find anywhere else. Now here we are in one of our exam rooms where we're going to actually pick a lens and put it on the patient's eye. So the first thing I wanted to do was just highlight the level of vision that individuals with keratoconus have, and this has really inhibited Kayla's ability to get a car and really function and drive. So right now she's not legal to drive. So right now her best vision, are you able to see that there?
Yes.
Go ahead. D, okay, and that?
H.
Okay.
It's 2 letters,
Those-
so I really can't. OC.
Okay, so just about getting there. And what about this one?
DL.
Okay, so right there you could see that's about where it tops out for her vision. That's about 2150, which is, you know, very, very difficult vision. You can see those letters are quite large. And glasses, we've checked her prescription for glasses. We've tried that, and that gets her vision to about 2100. Okay, so currently uncorrected vision is around 2150, and with glasses about 2100. So the next thing we do is we take the information we got from the topography map, which you can see behind me here, is a measurement of, again, of the shape of the front of her eye, and we could see that it's very, very steep in this area, creating an irregular shape to the cornea, which is something called keratoconus. And so that inhibits her ability to see with conventional glasses and contacts, which he's highlighted for us here today. So what we've done is we've taken the shape of her cornea, the measurements that exist there, and we've utilized that in designing a very special contact lens that's made for her and only her. This type of lens is called a scleral contact lens. It's a large diameter, firm lens. It's actually very, very comfortable and bathes the eye in solution all day long. So it's a very comfortable lens. You've been wearing other lenses. Tell me about the comfort of these other lenses.
They fit like a rock.
Fit like a rock. So not many people want to put a rock in their eye,
No,
right? So I think, you know, and then we put this lens on. What was your experience with this lens, comfort-wise?
It feels very good.
Very comfortable.
Yeah,
Wonderful.
very.
So what we're going to do today is actually show you the process of putting the lens on. It's definitely unique. It's definitely unlike any other type of lens. So I want people to really know what that's like and what's involved in the process. So we use a special type of scleral contact lens called the Custom Stable, which is a fantastic quality lens. Every time the patient gets a set of lenses, they get this really nice case and some solution that comes in a nice container to hold all of these things together. So really, really great thing here for the patients. Next, we're going to grab the contacts themselves, which come in the container, and we're going to remove them and place them on the patient's eye. Now, the process, we actually have her lenses here today, which is very exciting because she's never had them on before. So at first, we use these containers, which have literally hundreds of different lenses in there that allow us to pick a lens that's going to fit best for the patient. So we use these diagnostic lenses to then order a lens that's going to be made specifically for this patient's eye, again, because everyone's eye is unique with keratoconus. So we have the lenses here ordered already today, so we're going to place them on the patient's eye. So we're going to remove the lens from the solution in the container, and you can see this lens is a large lens, actually. It's quite big, it's firm, and you would think something like this would be uncomfortable on an eye, but you'll see it's actually quite comfortable. The next thing we're going to use is a insertion device. This is called the DMV. It's kind of like a plunger, so we're going to take the lens and we're going to place it with suction onto the plunger, and you'll see here it's on there, firmly attached, not going to fall off, really easily attached there. The next thing we're going to do is we're going to fill the lens with saline solution as such, and you can see we fill it up so much so that it's almost overflowing with solution, and that's the solution that bathes the eye during the day while the lens is on, and it's really the magic that allows for the clarity of vision that scleral lenses allow. The vision is actually corrected by the solution or the liquid in there, not as much the lens like in other correction modalities. So then we're going to have the patient put the lens on. Usually for the first time, I put the lens on the patient. So I lift them up a little bit so they're at my level. I have them look straight down. I have them lean forward a little bit, look straight down, and then we're going to place the lens on the eye and see how she sees. I'm going to lift over here, grab her upper lid, look down, look down, look down, look down, look down, look down. Good. Okay, look straight ahead, look straight ahead. Good. How does that feel?
Very clear.
Very clear.
Very
All right,
clear.
wonderful. I love that. All right, so then we're going to get the other lens and put that on. Tilt your head down. Look straight down. Good. Look straight ahead. Good, it's on. Okay, so now we have both lenses on the eye. Okay, and so we're gonna ask the patient first, you know, how do you feel? How do the lenses feel? Can you feel them at all?
I don't feel them.
Don't even feel them. That's
No.
fantastic. And how does everything seem? Does it seem different?
Clear. It feels like I have two brand new eyes.
Wonderful. So have you ever been able to see this way?
No.
Wonderful. That's fantastic. And I never get tired of hearing that. Ever, ever. So then we're going to take our slit lamp and evaluate the front of the eye. So go ahead and look in there. Go ahead and put your chin there on the chin rest, forehead up against the top bar. Look out at my right ear. So we're going to take a look at the eye, make sure that the lens is not touching the cornea, and it's not. Same thing over here. Looks beautiful. So I'm going to snap a few pictures and then we're going to look at this. Okay, you can relax. All right, so I snapped a few pictures here for everybody to see. So what I'm going to do is show you here these pictures. So this is a high magnified image of the front of the lens and the back of the lens. So the front of the lens is this structure, this light right here. The back of the lens is right here in between the dark and the green. The green is actually the solution in between the lens and the eye. So when we're looking at this lens, we want to make sure that there is space in between the lens and the eye, because again, that's where the liquid is and that's what's correcting the vision. And we want to make sure that this lens is not touching the cornea. So when we look very closely, this kind of hazy beam right here is the cornea itself. So we can see that this is an excellent fit. There is no touching of the lens to the cornea. So she's going to be very, very comfortable with this lens. The next thing we do is we want to look at the side of the eye where the lens is actually resting on the white of the eye. So this lens is not sitting on the cornea, it's sitting on the conjunctiva or sclera, and that's why it's called a scleral lens. So you can see here this really fine red line. That fine red line is a blood vessel in the conjunctiva, and you could see that it starts outside of the lens and it traverses underneath the lens unimpeded, and that means that the lens is sitting nice and calmly on the conjunctiva, and this is going to be a very nice, comfortable fit for her. So these are the pictures that we want to see when we fit somebody with a scleral lens. So this is really a perfect fit, very, very healthy. If we look really closely here at this picture, you could see there's some really fine lines in the hazy area here of the cornea. Those fine lines are something called Voigt striae. They are folds in the inner layer of the cornea that are found with moderate to advanced keratoconus, and this is something that we see here in Kayla's eyes and something that we're going to monitor as we watch her condition and make sure it does not progress. So that's really the next step in our taking care of Kayla, is making sure that these lenses continue to be healthy for her and continue to allow her to see clearly like she's never seen before. So let's take her vision now and see how she's doing. So Kayla, are you able to see that there?
E-D-O-T.
Fantastic. Anything here on this line? Take it one letter at a time.
D-L-C-N.
That's fantastic. You can see she's working at it. This is pretty tough, but that's 20/40. 20/40 vision is the legal limit for driving. And so, you know, I think, you know, what I really want to highlight here today is that these lenses, if you've been told that you can't see any better, if you've been told that your vision is as good as it gets, if you've been told that, you know, you're unable to wear contacts and it's greatly affecting your life, this might be the option for you. Scleral lenses, in Kayla's case, are going to allow her to drive again, which is really a miracle. So here we are at Hazleton Eye Specialists, more specifically the Scleral Lens Institute, both at Hazleton Eye Specialists and Stroudsburg Eye Specialists. We're located at 281 Airport Road, Hazel Township, Pennsylvania. Telephone number is 570-453-2020. We're also located in Stroudsburg at 852 North 9th Street. Telephone number there is 570-421-3342. Check us out on drkislin.com. If you have keratoconus or someone you know has keratoconus, give us a call for an evaluation for scleral lenses today. It just might change your life like it did with Kayla. Kayla, thank you so much for being here today.
Thank you so much.
It's been a pleasure.
It's been a pleasure too.